Welcome to Boston Community Health. I'm Dr. Elias Thorne. Why does geriatric medicine officially designate type 2 diabetes as the master driver of all devastating complications? Widespread individuals mistakenly assume this pathology is merely a localized concern of glucose fluctuations around the pancreas. However, clinical reality exposes 5 terrifying truths silently destroying your longevity, starting right at the vascular foundation, specifically the direct link to the catastrophe of Alzheimer's disease. If you maintain persistence and stay with me across 30 sections of this video, your home medical protocols to rescue your vasculature and protect your cognitive clarity will become entirely clear today. A primary metabolic error past age 40 involves dangerously ignoring subtle silent signs, allowing chronic insulin resistance to covertly ravage the intricate network of intracranial capillaries nourishing your brain tissue. Horror number 1 that we strictly must never overlook is the complete collapse of your renal filtration architecture. When baseline blood glucose concentrations remain chronically elevated, your circulation ceases to function as a fluid nutrient stream, transforming into a thick, sticky solution resembling heavy sugar syrup. This toxic blood volume erodes and microscopically tears the delicate glomerular basement membranes wherever it flows. Your kidneys are forced to overwork under extreme hydrostatic and osmotic pressures, driving massive protein leakage into your urine. Over time, these structural filtration units experience permanent fibrosis and perish, submissively pushing patients into end-stage renal failure, forcing them to spend their remaining lifespan chained to an unfeeling dialysis machine inside hospital units. Horror number 2 incorporates diabetic retinopathy driving irreversible and permanent blindness. Please click like, subscribe to Boston Community Health, and comment right now. Persistent hypoglycemia continuously erodes the microscopic capillaries lining the back of your eyes, weakening vessel walls and triggering sudden microvascular hemorrhages. Your brain attempts a structural rescue by initiating the proliferation of abnormal new blood vessels, which remain highly fragile and unstable. When these defective vessels rupture, blood floods the vitreous cavity, forming dense fibrous scars that detach the retina, completely extinguishing your eyesight. Recognizing temporary blurred vision really represents your singular window to rescue your ocular health before darkness falls, stripping away your independent living. Horror number 3 presents as diabetic peripheral neuropathy systematically destroying your lower extremities. Chronic high glucose functions as a chemical acid dissolving the protective myelin sheath covering nerve fibers, while completely occluding the small capillaries feeding peripheral nerves. Patients endure severe numbness, pins and needles sensations, or total loss of physical feedback inside their feet. This means you could step on a sharp object or develop a deep, infected laceration without experiencing a single shred of pain. Because thick, nutrient-poor blood fails to deliver white blood cells for repair, the tissue experiences rapid necrotic ulceration, forcing surgeons to perform amputations to save your life. Horror number 4 delivers the aggressive construction of unstable, fragile atherosclerotic plaques inside your carotid pathways, directly triggering catastrophic territorial embolic strokes, destroying neurons. These silent lacunar infarct events cause zero immediate physical paralysis, yet across chronological decades, they covertly fracture vital neural signaling transmission within your white matter architecture. Now, we advance into the ultimate horror, the absolute peak of destruction driven by this master disease, Alzheimer's dementia. Modern clinical science and geriatric neurology inside the United States have officially designated Alzheimer's as type 3 diabetes. This represents far more than a simple hypothesis, standing as an evidence-based medical fact. When cellular insulin resistance progressively expands and breaches your skull framework, your cerebral neurons completely lose their capacity to recognize insulin keys. Because insulin serves as the singular key helping brain cells absorb glucose for metabolic fuel, the distortion of these receptors plunges your entire cerebral cortex into a state of severe starvation, driving widespread neuronal death. As cerebral neurons continuously starve due to this type 3 diabetes phenomenon, your brain's specialized lymphatic cell-cleaning mechanism completely collapses, losing its capacity to clear intracranial metabolic waste. The direct consequence is the aggressive accumulation of toxic amyloid beta protein plaques and neurofibrillary tau tangles around your frontal lobe and hippocampus, the core architecture governing human memory storage. These destructive structures function exactly like a biological cement suffocating and completely severing signaling transmissions across neural synapses. Your brain cells atrophy and perish in massive volumes, systematically stripping away your most precious memories regarding family, leaving behind an empty physical shell. Confronting these 5 horrors, geriatric medicine does not force you to surrender, delivering a synchronized system of scientific solutions to rescue yourself right at home. Actionable management. Option number 1 to shield your cerebral microvessels requires implementing the sequenced fiber-first dining protocol. During every single meal, you must consume a plate of steamed green vegetables rich in soluble dietary fibers before touching proteins or carbohydrates. As fiber arrives inside your stomach first, it constructs a dense biological gel mesh coating your small intestinal mucosa. This protective barrier functions effectively as a sophisticated filter, severely delaying sugar absorption into your bloodstream, completely neutralizing volatile post-meal glucose spikes. Actionable management. Option number 2 focuses on executing the continuous 15-minute stationary calf raise routine immediately following your meals. Please click like, subscribe to Boston Community Health, and comment your meal choice below. This seated movement intensely activates your lower leg soleus muscle, which possesses a unique biological capacity automatically drawing glucose directly from circulation to burn for physical fuel completely independently, requiring zero assistance from insulin keys currently resisted by your cells. This cost-effective mechanical protocol pulls your chronic hemoglobin A1C back into the safe zone below 5.7% spectacularly, entirely removing the mechanical shear stress straining your cerebral vessels, shielding your intracranial white matter from afar. Actionable management. Step number 3 is highly unique and delivers exceptional clinical efficiency, incorporating the utilization of an organic apple cider vinegar protocol 15 minutes before dining. Dilute 1 teaspoon of raw apple cider vinegar into a large glass of warm water, consuming it through a straw to safely safeguard your tooth enamel. The active acetic acid component functions effectively as a natural inhibitor, slowing down alpha-glucosidase starch-digesting enzymes inside your small intestines, blocking sudden glucose tsunamis from releasing into circulation while simultaneously boosting peripheral muscle insulin sensitivity by up to 30%, shattering the vascular inflammatory loop. Actionable management. Step number 4 focuses on optimizing your nocturnal deep sleep architecture by proactively distributing your fluid intake during daylight hours. Distribute your water volume equally across morning and afternoon schedules, while strictly restricting fluid consumption past 8 p.m. This habit successfully prevents bladder volume overload, entirely eliminating disruptive nocturnal urination episodes that fragment your sleep. When your deep sleep remains perfectly preserved, your brain's lymphatic system gains adequate biological time to clear toxic amyloid beta plaques, breaking the remote risk of launching type 3 diabetes, destroying your hippocampus architecture. Actionable management. Step number 5. The ultimate shield to completely master your medical destiny involves implementing an advanced annual microvascular screening protocol inside specialized hospital facilities. Standard structural physical exams and generic finger prick blood tests remain completely blind to localized Tourette's expanding inside your vessel walls. Coordinating a duplex carotid ultrasound evaluation behind the neck to measure intimomedial thickness and undergoing high-resolution brain MRI scan functions as the supreme diagnostic imaging solution to expose silent lacunar infarct threats before devastating complications strip away your cognitive clarity. I want to leave you with a profound clinical philosophy of geriatric medicine, the devastating complication you successfully prevent through your intelligence and consistent daily movement will never make dramatic breaking news. The stroke or cognitive decline pushed back from afar carries no intense resuscitation moments inside an emergency operating room. It remains completely quiet. The beautiful outcome of that wise prevention is just an ordinary morning where your brain stays sharp, your steps remain steady, and you continue enjoying warm conversations with family. You do not need to live under passive anxiety or surrender your biological destiny to an unfeeling automated medical framework. The ultimate mission of geriatric medicine at Boston Community Health focuses entirely on protecting your physical freedom, sustaining your baseline cellular energy, and preventing devastating vascular dementia or Alzheimer's disease from afar. You no longer need to analyze your elevated hemoglobin A1C metrics with a sense of passive helplessness, shielding your intracranial blood vessels right from your dining table through sequenced nutrition and soleus muscle calf raises represents the wisest anti-aging intervention perfectly preserving the non-stick integrity of your central nervous system. Transform every single day into a personal campaign for natural vascular clearance. We understand that confronting these 5 horrors of type 2 diabetes can generate significant confusion and anxiety for patients. Widespread individuals globally have succumbed to devastating complications, stripping away their lifespan simply due to a severe deficit in authentic clinical knowledge. Therefore, this medical video series is meticulously designed to serve as your operational roadmap, empowering you to confidently communicate with your physician and assume absolute autonomy over your well-being. Always stay sharp, stay highly informed via accurate medical data, and maintain persistence to protect your healthy longevity path. Within next week's educational series, we will deliver advanced clinical investigations targeting strategies to reverse chronic fatty liver disease, a dangerous pathology frequently traveling alongside and amplifying middle-aged insulin resistance. This represents a highly critical subject, helping you construct your complete metabolic defense network, maintaining your peak physical clarity regardless of the passage of chronological time across your lifespan. Remember clearly that naturally clearing your peripheral glucose begins directly from your dining table and your moderate microvascular exercise routines, listing the immense workload straining your pancreas without chemical costs. Share this educational video link with the people you care about most, a spouse living alongside you, an aging parent, or a sibling over middle age who needs this vital screening data. The individuals who are at the highest statistical risk of facing this chronic sugar-induced vascular storm will likely never search for these advanced clinical studies online. Your small act of digital sharing today might become the exact reason someone's vascular system and cerebral white matter are saved, perfectly preserving their independent living while halting renal failure or devastating retinal blindness. Any ethical, highly competent physician will completely welcome these 3 strategic questions from you during your physical examination. They will deeply respect your medical intelligence and appreciate your self-advocacy, because they comprehend that an informed patient represents an exceptional partner during a long-term medical journey. Conversely, if your physician dismisses these advanced diagnostic imaging queries or makes you feel difficult, that acts as crucial diagnostic information proving that specific doctor is simply not the right fit for your longevity path. Maintain firmness in seeking a healthcare professional. Bring all of today's vital medical insights together. We have thoroughly exposed the destructive clinical nature of these 5 horrors this master disease utilizes to systematically erode your vascular endothelium. Implementing the sequenced fiber-first dining protocol and soleus muscle calf raises represents your ultimate natural weapon to clear glucose, successfully shielding your hippocampus architecture from Alzheimer's. To successfully transform today's complex scientific knowledge into a practical protective weapon for your next physical checkup inside specialized hospital facilities, I want to provide a concise clinical communication protocol consisting of 3 strategic queries to discuss directly with your healthcare provider. When you confidently present these highly informed academic queries, you force the physician to concentrate on constructing a personalized prevention framework tailored precisely for your physical status, completely eliminating vague guesswork, allowing you to actively master your cerebral vascular architecture from afar. Strategic query number 1 you strictly need to present to your physician is based on my middle-aged physical status and current insulin resistance signs. What are the exact target blood pressure metrics and optimal hemoglobin A1C thresholds I must maintain during home logging? This crucial query forces the clinical conversation toward establishing a clear biological milestone, allowing you to accurately evaluate the real-world efficiency of your daily microvascular movements and dietary changes, entirely removing the mechanical shear stress straining your renal membranes, halting end-stage renal failure. Strategic query number 2 you strictly must discuss during your clinic appointment is given my structural vascular risks driven by chronic hypoglycemia. Am I an appropriate candidate to undergo a duplex carotid ultrasound and a brain MRI scan to evaluate for silent lacunar infarcts? This question advances your medical dialogue into specialized neuroimaging dimensions, completely exposing and detailing underlying arterial threats expanding inside your skull before fragile atherosclerotic plaques rupture, destroying neurons and activating territorial strokes or type 3 diabetes. Strategic query number 3 you strictly need to ask to finalize your metabolic protective shield is, Do I require an overnight 24-hour Holter monitor evaluation right at home to completely rule out paroxysmal atrial fibrillation risks driving nocturnal clots? Presenting this complete trio of strategic queries demonstrates that you represent a highly informed individual possessing profound wisdom during your personal journey to safeguard your physical freedom, clear retinal vision, and cognitive clarity across lifespan, refusing to surrender your body to chronological time. Write down these 5 natural methods and 3 strategic questions on a physical sheet or store them inside your phone app to serve as your permanent roadmap. Many individuals dangerously delay lifestyle modifications, waiting until severe vascular complications like necrotic foot ulcers, retinal blindness, or cognitive dementia erupt before panicking and seeking chemical prescriptions. This represents hazardous vascular suicide. The true clinical power to shield your endothelium resides entirely inside your consistent daily discipline over small habits at home, completely calming cellular insulin resistance from the foundation. The compounding effect of a small habit extending from day to day creates a highly powerful anti-aging clinical intervention over time, successfully preserving the non-stick integrity of your microvascular networks, nourishing your brain and heart. A sharp cognitive mind free from plaques and complete physical independence represent your most priceless assets. To thoroughly enjoy your peace and happiness alongside family, you possess the biological power to effectively shatter the destructive cascading loop driven by chronic type 2 diabetes through fiber-first dining choices, locking your sugar stable. Implement the sequenced fiber-first dining protocol and execute your moderate soleus muscle calf raise routines starting today to successfully neutralize the Dorn phenomenon, protecting your hippocampus across lifespan. Please click like and subscribe to Boston Community Health right now and leave a comment below about the specific car that concerns you most. Wishing you continuous health and see you next time.